I am Dr. Sahar Ravanshad. I am an internal medicine specialist, a faculty member at Mashhad University of Medical Sciences. The patient we are seeing today is a 60-year-old lady. She has been suffering from diabetes. She has also experienced one of the complications that can occur in patients with poorly controlled diabetes. She was admitted to the hospital with decreased consciousness and severe bilateral pneumonia. She was immediately intubated due to decreased level of consciousness and respiratory distress as she was on the verge of respiratory failure. She was connected to a ventilator. During the examinations that were performed on her, there was very severe and bilateral involvement, and considering the current season and the onset of the flu outbreak with suspicion of influenza, and since there are still some cases of COVID being seen, they were tested for both influenza and COVID. Given that their condition was extremely critical, we started them on influenza treatment. However, during the course of treatment, we were not getting a satisfactory response. From the influenza and COVID treatments that we administered to them, during the bronchoscopy that was performed, all tests for fungal and bacterial infections were conducted on them. But quite strangely, all the tests were initially reported as negative. We repeatedly took cultures from their tracheal secretions and intubation tube every 3 to 4 days, and eventually we were able to identify the organism, which was Acinetobacter, an organism commonly seen in ICUs. Unfortunately, the patient's Acinetobacter was also resistant to treatment. But despite the fact that we started them on broad-spectrum antibiotics and began treatment with colistin and corticosteroids, they responded well to the treatment and fortunately were weaned off the mechanical ventilator. Their fever subsided, their blood sugar was completely controlled, and they are now in good general condition and ready for discharge. This is the patient's CT scan upon admission to the hospital. As you can clearly observe, there is significant bilateral involvement, presenting with extensive and widespread bilateral lobar pneumonia, which is a severe form of lung inflammation affecting both lungs.